Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on an umbilical hernia, which is more common in children, but also is also found in males and females in older age as well. But it is usually found in children, in infants. So let us discuss what it is. An umbilical hernia occurs when part of your intestine bulges through the opening in your abdominal muscles near your belly button, navel. Umbilical hernias are common and typically harmless. Umbilical hernias are most common in infants, but they can affect adults as well. In an infant, an umbilical hernia may be especially evident when the infant cries, causing the belly button to protrude. This is a classic sign of an umbilical hernia. Children's umbilical hernias often close on their own in the first 2 years of life, though some remain open into the fifth year or longer. Umbilical hernias that appear during the adulthood are more likely to need surgical repair. What are the symptoms? An umbilical hernia creates a soft swelling or bulge near the navel. In babies who have an umbilical hernia, the bulge may be visible only when they cry, cough, or strain. Umbilical hernias in children are usually painless. Umbilical hernias that appear during adulthood may cause abdominal discomfort. When to see a doctor? If you suspect that your baby has an umbilical hernia, talk with the baby's doctor or a pediatrician. Seek emergency care if your baby has an umbilical hernia and appears to be in pain, begins to vomit, has tenderness, swelling, or discoloration at the site of the hernia. Similar guidelines apply to the adults. Talk with your doctor if you have a bulge near your navel area. Seek emergency care if the bulge becomes painful or tender. Prompt diagnosis and treatment can help prevent complications. And what are the causes? During gestation, the umbilical cord passes through a small opening in the baby's abdominal muscles. The opening normally closes just after birth. If the muscles do not join together completely in the midline of the abdominal wall, a umbilical hernia may appear at birth or later in life. In adults, too much abdominal pressure contributes to umbilical hernias. Causes of increased pressure in the abdomen include obesity, multiple pregnancies, fluid in the abdominal cavity, previous abdominal surgery, and long-term peritoneal dialysis to treat kidney failure. What are the risk factors? Umbilical hernias are more common in infants, especially premature babies and those with low birth weights. In the United States, black infants appear to have a slightly increased risk of umbilical hernias. The condition affects boys and girls equally. For adults, being overweight or having multiple pregnancies may increase the risk of developing an umbilical hernia. This type of hernia tends to be more common in women. What are the complications? For children, complications of an umbilical hernia are rare. Complications occur when the protruding abdominal tissue becomes trapped, incarcerated, and can no longer be pushed back into the abdominal cavity. This reduces the blood supply to the section of the trapped intestine and can lead to the abdominal pain and tissue damage. If the trapped portion of the intestine is completely cut off from the blood supply, it can lead to tissue death. Infection may spread throughout the abdominal cavity, causing a life-threatening situation. Adults with umbilical hernias are somewhat more likely to experience a blockage of the intestine. Emergency surgery is typically required to treat these complications. Now we would come to the section of diagnosis and treatment. As you know that an umbilical hernia is diagnosed during a physical exam. Sometimes imaging studies such as abdominal ultrasound or a CT scan are used to screen for complications. What is the treatment? Most umbilical hernias in babies close on their own by the age of 1 or 2. Your doctor may even be able to push the bulge back into the abdomen during a physical exam. Don't try this on your own. However, although some people claim a hernia can be fixed by tapping a coin down over the bulge, don't try this. Placing tape or an object over the bulge does not help, and germs may accumulate under the tape, causing infection. For children, surgery is typically reserved for umbilical hernias that are painful, are slightly larger than 1/4 to 3/4 inch, 1 to 2 centimeters in diameter, are large and do not decrease in size over the first 2 years of life, or do not disappear by the age of 5, or those hernias which become trapped or blocked the intestine. So these are the indications for surgeries. Then we would come for adults. For adults, surgery is typically recommended to avoid possible complications, especially the umbilical hernia gets bigger or becomes painful. During surgery, a small incision is made near the belly button and the herniated tissue is returned to the abdominal cavity and the opening in the abdominal wall is stitched closed. In adults, surgeons often use mesh to help strengthen the abdominal wall. Preparing for your appointment: if you or your child has signs or symptoms common to an umbilical hernia, make an appointment with your family doctor or your child pediatrician. Here is the information to help you prepare you for your appointment and know what to expect from your doctor. What you can do is that list any signs or symptoms you or your child has had and for how long. Bring in a photo of the hernia if signs of the problems are not always evident. Write down key medical information including any other health problems or issues and the names of any medication you or your child is taking at present. And write down questions you want to be sure to ask your doctor. Question to ask your doctor: is the swelling nearby or my child's belly button an umbilical hernia? Is the defect large enough to require surgery? Are any tests needed to diagnose the swelling? What treatment approach do you recommend, if any, and might surgery become an option if the hernia doesn't get better? How often should I or my child be seen for follow-up exams? If there is any risk of complications from this hernia, what emergency signs and symptoms should I watch for it at home? Do you recommend any activity restrictions? Should a specialist be consulted? If any additional questions occur to you during your visit, don't hesitate to ask. What to expect from your doctor? Your doctor is likely to ask you a number of questions, such as when did you first notice the problem? Has it gotten worse over time? Are you or your child is in pain? Have you or your child vomited? If you are the one affected, do your hobbies or your work involve heavy lifting or straining? Have you or your child recently gained a lot of weight? Have you or your child recently been treated for any other medical conditions? Then you have to talk with your doctor. Do you or your child have a chronic cough? Then talk with it to your doctor. He will describe you all about hernia and about its complication and surgical approaches. So it was all about umbilical hernia. I hope so that this video would be more informative for the audience, and if you have liked this video, then kindly share this video with other individuals as well. And I hope so that if you have liked this video, then you will subscribe to my channel and have a wonderful nice day. Thank you for listening this video and watching this video.